Hello and welcome. My name is John Court. I am the Deputy Medical Director and Listening into Action Lead. We've had a great continuation of our improvement journey this year. This video shows 4 of our teams, both from primary and secondary care. It shows that we are committed to improving patient care and improving the working lives of our staff.
I'm Sally Ledet, part of the safety management team, and I also lead the staff environment group. There were a number of staff who had contacted me regarding wanting to increase recycling in the trust and also telling me how interested they were in environmental issues. There was a lot of energy and enthusiasm from this group of people. So I decided it would be a good idea if all these staff could meet up together. We meet once a quarter to discuss environmental issues and make improvements to make the hospital more eco-friendly. We've been able to work on a number of projects. We have increased the recycling in the hospital. We have introduced the wall pit reuse system. We've introduced the Bring Your Own Bottle campaign. We've introduced vegan food into the staff restaurants. We have also won the NHS Sustainable Development Awards this year. There is still a lot of work to do, but working together we can achieve far better results.
My name is Matthew Norris. I'm a consultant orthopedic surgeon at Chesterfield Royal Hospital and the clinical director for Orthopedics. Fracture Clinic had multiple problems that needed addressing, and we started this project to really tackle the issues of the overwhelming volume of patients that were being referred through the emergency department to Orthopedics for a musculoskeletal problem. Nationally, trauma has been growing at 5% year on year, and the resources haven't grown at a rate that kept up with that. We've gone from a direct face-to-face consultation with all of our patients to a triage type virtual clinic where we're able to assess the notes from A&E and the x-rays of the patients and stream those into the most appropriate pathway for treatment.
Hello, my name is Claire Wunwell. I'm the Assistant Service Manager for Orthopedics and Specialist Surgery. The changes we've made have benefited patients, so they're not having to come back to clinic. They're saving on car parking, they're saving on a 10-minute appointment, but realistically being here for 3 hours. For clinic staff, it saves on the pressure of long delays in clinic, patients being unhappy, and it's benefited patients because the patients who can be seen, who need seeing, can be seen in a timely manner.
Hello, my name is Kate Turner. I'm the Digital Improvement Matron. One of the areas we found where this trust could make improvements was in the initial recognition and then the subsequent management of deteriorating patients. What we did was look at other trusts and see what digital solutions they were using, and we found the best fit for us. Then we blended the IT specialists with a clinical face so that we can enable the project to work for both sides.
Hello, my name is Barnaby Franklin and I'm an IT project lead here at Chesterfield Royal. Electronic observations has been a great opportunity for the ICT team to help the Trust on its digital journey, moving towards the Trust's goal of an electronic healthcare record. From an IT point of view, there was various prerequisites, including the upgrade of a patient administration system and the deployment of a number of iDevices. Both clinical and non-clinical staff have worked together to deliver the project. We are supplying the involved areas with a number of iDevices and charging stations, which will be managed by the ICT team, enabling the real-time reporting of patient information.
From a patient perspective, this has allowed us to escalate their care more effectively and allow clinicians to see what patients' observations are remotely, and they can act immediately using decisions from information they've got straight in front of them.
My name's Ellie Trown. I'm team leader and carers champion for Claycross and Grassmore sites. The Carers Choice campaign came about because we realised that we'd got carers in surgery but that weren't being identified. So it was about promoting the carers and what we could offer them in surgery, and also what the carers champions could do to support the carers and their families as well.
So I'm Leanne Matusovic, I'm site lead nurse for Royal Primary Care at Claycross and Grassmore Surgeries. I was asked to lead on improving our carers within the practice is an area with CQC. So I facilitated a meeting with Rebecca at the Trust for us then to see how we could improve carers within primary care. We decided, after speaking to some of the staff here, that we would have some champions at each site, so that meant patients had access across the whole of the sites. And it was also having a meeting together where we all brought our ideas and how we could facilitate that across all sites, and it was all the same.
It's made quite a big change actually. People much more interested in coming up and looking at the displays, feel much more able to ask questions, ask to speak to a carers champion if they want to. They're quite keen to identify themselves as carers now. I think a lot of people don't see themselves as carers because they're not doing it they're not paid for it. They're perhaps looking after a family member or a friend, so they don't identify as being a carer, and actually they are, and that's one of the things that we wanted to get across through this campaign.
As you can see, we are committed and proud of our staff on their engagement journey. They're improving both their own welfare and clinical care. The Improvement Academy is going from strength to strength, with hundreds of staff being trained in improvement techniques this year. Thank you very much for watching.